So the question is, with the new part two of the retail pharmacy, how is it working, and how are we just trying to streamline people's access to those pharmacies? And I'll first say that I can't say enough good things about Dr. Stephanie Weewell, our state pharmacist, and the work that she's done to work out all of these different arrangements with a lot of different pharmacy partners. Our goal and our intent absolutely is to continue to prioritize the 65 and up population across all pharmacies. We know that is our highest risk population in 1B and want to get as much access to vaccine as we can. And then also to honor the pre-registration process, right? The lists that people have signed up for and been placed on. And so all of this has moved incredibly fast. We find out last week from the White House, that this is opening up. We have 24 hours to determine who those pharmacy partners are. We executed those arrangements and have been over the last few days ironing out the logistics of how you actually get from a pre-registration list to an appointment with a pharmacy. The good news is that all of those new pharmacies have said we are absolutely willing to work. Not all, but most of those pharmacies are willing to work off of those lists. That's happening through a few different ways. So Dr. Weewell really, just to not slow vaccination at all, said go ahead and use your appointments, focus on the 65 and up, but just do that for the first few days. And as we have the local health departments curate their pre-registry lists, and then either the call center, as you heard earlier, is doing some outbound calling to fill some of those appointments. Local health departments themselves are staffing up to fill some of those appointments. And then in some cases, the pharmacies themselves are calling off of that list to fill some of those appointments. So I think a few days from now, we're really going to be able to make sure that those pre-registration lists are honored, and that's filtering into pharmacy appointments across the state.